Where should you place pads for elective cardioversion? Apicolateral or anteroposterior? We'll review the EPIC trial in this episode of Osler Shortcuts. Where to place the pads for a cardioversion has been an unresolved controversy. Both apicolateral and anteroposterior positions have their advocates, with some data suggesting that different parts of the heart respond differently to a change in the current vector. However, there is currently insufficient outcome data to support a conclusion. The EPIC trial sought to resolve the issue by randomising 468 patients who required elective cardioversion for atrial fibrillation. Up to 4 synchronised shocks were delivered in an escalating manner from 100 to 360 joules. The primary outcome, the proportion of patients in sinus rhythm 1 minute after the first shock, was significantly higher in the anterolateral group, a 22% absolute difference, which correlates with a number needed to treat of 5. Similar differences were seen at discharge, and significantly fewer shocks were required in this group. There are, as always, some things to bear in mind when interpreting these results. The study used an escalating energy dose, in contrast to the most recent update of the European Society of Cardiology guidelines, which recommends using a maximal dose from shock 1. It's unclear whether the benefit of anterolateral positioning would be seen in a different context. Additionally, the study was performed in stable patients with atrial fibrillation. It's unknown whether this effect would also have been seen in emergency settings or for different arrhythmias. If you'd like to learn about this study in more detail, you can find the module on MyOsler. Just follow the link in the details page for this video. See you next time on Osler Shortcuts.